Most of the people watching this will be pharmaceutical companies, pharmaceutical executives, but obviously we're all patients, and people who are patients who have no connection with pharma will be watching. Do you have a message for those patients as well? What can those people be doing to actually gain greater strength and actually push for that transparency and access that you've just spoken about?
I think patients need to connect with one another. We want to do that. We want to know we're not alone. And then when you get together, you say, well, okay, what are the problems we face? How can we live better, live longer? Are there obstacles at the clinic level? Are there obstacles in access to care? Are there laws that prevent us from getting the information that we need and deserve? And then we, march on government. And industry can support that as well. But it's something I think we legitimately as patients want. We just need to connect the dots among ourselves. If industry can facilitate that, that's great. That's really about germinating, if you will, advocacy and doing it country by country, city by city, and that's a very worthy thing. It helps patients be powerful.
Well, you mentioned germinating advocacy, and there are still advocacy groups, and they are important organizations. So what can advocacy groups actually do themselves to take advantage of these trends?
I think there need to be digital strategies. We're on video now, okay, and people can see that in the most remote corners of the world. Many of the advocacy groups were started with well-meaning people with even one-to-one support, locked in kind of the 20th century. We're in the 21st century now. We have all these technology tools. We have all these aspects of health now, monitoring and communication can be brought to bear to have much greater impact at much lower cost, and with frequency. Because when you're living with a condition, you want frequent updates, frequent support, frequent connection, right? And it can be for you and segmented for various family members who may support you. So advocacy groups need to be much more aggressive, if you will, in communication strategies. Now, industry can support that, because the advocacy groups have credibility and connections that, quite frankly, the pharmaceutical companies do not. However, we're still at a time when many pharmaceutical companies decide to produce tools on their own. And the truth is that either for lower credibility or lack of communication with patients, they're often not discovered or not used very much. And they're not surrounded by frequently changing information. So the bottom line is, more resources should be allocated to the advocacy groups, patient opinion leaders, independent sources, and less reliance on pharma trying to do it themselves.
Andrew, finally, you spoke a little bit earlier in your talk about needing to move beyond adherence, which has traditionally been the area of pharmaceutical focus with regarding to direct patient contact. And moving towards understanding lifestyle changes. Can you just elaborate a little more on what you mean by that?
Well, I think you have to see the whole patient. So the patient is not just a pill. Take this pill in the morning and night, and that is what anybody is focused on. It really needs to be about somebody trying to live life better, do what they want to do, be with the people they want to be with, have the strength to live well, do the hobbies, the activities, the work, have the relationships they want. And that's what pharma needs to see, the whole picture, not just the narrow, well, are they taking our medicine and are they taking it appropriately? Because there are a lot of obstacles get in the way, so you have to understand what's the whole person, what are their desires, what are their fears, what are the opportunities to help them understand where medicine plays a role in facilitating that, what are the obstacles for them taking their medicine, but it's the whole picture. And often, someone sitting in an office park somewhere is so removed from patients, they don't see that.
Thank you so much, Andrew, for talking to me today.
My pleasure.